Good afternoon, everybody. Welcome to another stellar performance from the virtual events that are put on by the New York State chapter of HIMSS. Today will be the first of a series dealing with mental and behavioral health. Today we're going to be discussing emerging behavioral health innovations, and we look forward to all of your participation in the future events as well. Next slide, please. For those of us that are on, here, take a look at the logistics. So if you lose the session, you can come back in again. The Q&A line will be open and it'll be monitored. So this way the moderator, if we see any great questions, we'll be able to bring them up to the panel and be able to help answer those questions for you. This will be recorded. We should have it up on both our website and our YouTube channel in approximately about 1 week. Next slide, please. As you can see, this is run by the New York State chapter of HIMSS. We welcome participation. Come and join us. I would also like to introduce now Elise Cole Grant, who will be our moderator for this series. Elise?
Hey, Tony, thanks for having me. You guys can hear me okay?
Yes.
All right, wonderful. I just want to give a huge shout out to New York HIMSS chapter for really giving behavioral health a platform like this to be part of the conversation. We are launching a behavioral health series with New York HIMSS chapter, and this series consists of 4 different webinars. This is the first one, so we're kicking this one off strong right before HIMSS 22, and I think that it's really exciting right now because we are changing the way that we deliver care, and we're changing the way as we as patients expect to receive care, especially in this new world of digitizing healthcare. So with that, if you can take me to this next slide, I want to kind of walk the folks through the trends that we're seeing right now and why this panel is so important to kind of speak about some of these different trends. If you look at the graph on the left, this talks about the digital venture capital health funding trend. So if you look back at 2010, you see barely $1 billion being kicked into this. But year after year, you kind of see it grow a little more. There's more demand in this space. And between year 2013 and 2016, you see kind of these VC dollars sort of plateau a little bit. And then it increases again in 2017, increases a little more in 2018, it goes back down in 2019, and then what happens is we're hit with a pandemic, and we see this drastic increase in digital health. I mean, look at 2021, we've definitely doubled from 2019, but these are kind of, it's skyrocketing, and it looks like it's continuing to grow. This is way more than we projected would be. And I think it really shows us that the market is changing, right? And one item I really want to point out about this is, we've reached over $30 billion in digital health funds, and $5.1 billion of that is dedicated to mental health, which is very new. I mean, I shouldn't say it's new. I should say that the way we talk about mental health is very new. I mean, 3 years ago, people weren't talking about mental health. It was almost taboo. And now you saw in the 2020 Olympics, Olympians are talking about mental health. Influencers are talking about mental health. I'll tell you, when I look at commercials, almost every time I hit a commercial, there's always some sort of acknowledgement about mental health. And it's really great that we are knocking down those barriers and making it easy for kind of the average person to be able to care about their mental health and be able to take control of their mental health, and for us to offer different solutions so that patients can better manage their own mental health. But we still have a long ways to go, right? And even we can see that, we are just starting to be part of the conversation. And I'm using behavioral health and mental health a little interchangeably here. And we're really kickstarting this off for HIMSS 2022, where Michael Phelps, who holds, I think, 23 gold medals right now. And he's been talking about mental health far before it became kind of this phenomenon where everyone's really paying attention to it. He's going to be one of the keynote speakers at HIMSS. And so, right now we're really in this world where we're normalizing caring for our mental health and for our behavioral health. And we see the market really demanding more solutions that help us to adopt this into kind of our everyday daily life tasks. So with that being said, if you can take me to the next slide. I couldn't think of a better quote from a woman that I've always admired, Shirley Chisholm. If you don't know who she is, I highly recommend that you Google her. She was very important, especially in New York State, where she really represented a district right here in Brooklyn, New York. I'm located in Brooklyn right now. And she was the first Black woman elected into the U.S. Congress. She also was the first Black woman to run for presidency. And, she has a quote that is my favorite, is if they don't give you a seat at the table, bring a folding chair. And one of the things that I've really tried to do throughout my career is, one, figure out where the table is, where the conversations are being had, and helping behavioral health providers and behavioral health advocates and behavioral health patients really come to the table, pull up a folding chair, and be part of this discussion, which is why I'm so happy today that right now we're giving behavioral health a seat at the table. In fact, when I was at HIMSS last year, and I told a lot of vendors that I was on the behavioral health sector, it was new. I didn't see a lot of folks in the behavioral health sector at HIMSS, and I really think it's important that we change that and that we start bringing folks to the table to have these discussions with us, which is why I'm so excited to present you with this panel of experts. If you can go to the next slide. Going to introduce myself real quick. Elise Cole-Grant, Chief Information Officer at IMS NY Innovative Management Solutions. We offer various products for networks specifically catering to behavioral health needs. We do geomapping, we do database management. We offer other clinical and analytic insights. And, I've spent years on the interoperability side, at the local government side, on the nonprofit, on the for-profit side, to really get an idea from different angles where behavioral health where behavioral health stands and what we can do to help really improve outcomes and leverage some of the technology tools that we see coming down the pipeline. So without further ado, I'm going to introduce you to Joanne, who is from Weill Cornell Medical College and Cornell University. Salome, who is the host of Going Digital, the biggest behavioral health tech summit. Neil, who's right now the Chief Medical Officer at Beacon Health Solutions, and John, who is the Chief Growth Officer at Able2. And I'm going to let them give a little intro because I think they can explain, what they do better than I can. So Joanne, if you could kick it off for us. I know that we're having a little difficulty getting Joanne on the line, so let me just kick it off to Salome. And Salome, if you can give us a little intro.
Hi, everyone. I'm Salome Tivabu. Thrilled to be here. I am the founder and host of Going Digital Behavioral Health Tech. Sounds like there might be a little bit of an echo, but like I was saying, I'm the host of Going Digital Behavioral Health Tech, the largest summit focused on advancing access to mental health and substance use care. And I've been involved in the field ever since I was an anxious teen, starting the first 14x-teen online resource in 2006. Lots of changes since then. So thanks for having me.
And if Neil, we can put it over to you.
Great, thank you, Elise. Great to be here. I'm Neil Leibowitz. I'm the Chief Medical Officer of Beacon, which is Anthem's behavioral health company. So we cover something to the order of about 50 million lives. I am a New Yorker, so I like to shout that out, especially with a New York-based HIMSS chapter. And I've actually spent most of my career here. So prior to this, I was the Chief Medical Officer of Talkspace, and mentioning Michael Phelps, that was our spokesperson. So it was based in New York. Was at Optum as well, leading New York behavioral health. And then just for interesting tidbits, I had also run the behavioral health for the jails in New York at one point in my life. So Rikers was my home. So great to be here. Thank you.
Thanks, Neil. And John, over to you.
Thanks, Elise, and thanks to HIMSS and to this group. I'm really looking forward to the discussion. I'm John Stout. I'm the Chief Growth Officer at Able2, coming to you from the other side of the Hudson River over in North Jersey. At Able2, we're a tech-enabled behavioral health provider. We've got about 2,500 clinicians that deliver care today in all 50 states through our partnerships with plans. We deliver structured, outcomes-driven cognitive behavioral therapy, all done remotely, kind of wherever the patient needs us. So we work exclusively with plans as a provider across all markets. We track outcomes. I think that'll be something you'll hear about as a theme today, the need for outcomes and quality. So excited to talk about that. And that's it. Looking forward to the discussion.
Great, thanks. So let's kind of kick it off right now with some of the first questions. So, we sort of asked folks to send questions in, and one of the questions that came in, which I feel like is very related to the first slide that you saw me, where I kind of mentioned what the market demands and the VC funding trends that are going into digital health, specifically digital mental health today. And Salome, I think you're the first person to kind of put in the hot seat here is what's hot and what's not in the digital health world for mental health.
Yeah, at least as you've alluded to, so much has changed these last couple of years. But if I had to boil it down to one thing that's just really hot is this concept of companies that can provide the fastest access to behavioral health care. And that's both on the enterprise and direct-to-consumer side. I'm sure you've seen, besides the more established employer payer-focused mental health companies, Able2 and some others have raised a lot of money to be able to onboard thousands of customers because they could really provide access to providers. But now we're also seeing these direct-to-consumer companies raise tons of money to really accelerate bringing fast access to individuals, consumers, with whether that be therapy, coaching, med management, and so on. So I think I would say that seems like the top priority for a lot of companies right now.
And when you say fast access, can you talk about that? Does that mean someone's getting an appointment? Does that mean someone's being referred to appointment? What do you exactly mean by kind of a fast access? Right.
Yes. So if I were to just Joe Schmo on the street, try to find a therapist or psychiatrist, even in urban, rural, we're talking about months in terms of wait times. And so a lot of the digital behavioral health companies are implementing different models like step care models such that we can triage the right level of care to the right person to manage the fact that we just have such a shortage of specialized providers. And so that's one way that they're getting around trying to reduce that wait time a bit.
And John, I know that you've been in this space for quite some time. What's your thought on kind of like what's hot, what's not?
Yeah, a couple of things, and I would piggyback on Salome's comment around access, and I'd say kind of the first prong is like access, and it's a little bit of like not too fancy or different, kind of like the next generation of what I would call just a practice aggregator. And you've got these platforms who exist to kind of play that role in between a patient in need and a provider who has time available. And the benefit of that platform is like, hey, provider, I'm going to handle your scheduling, your billing. I'm going to deal with the managed care company. I'm going to, help you navigate all of those like technical things of delivering care virtually. You just make hours available to us. And it's like somewhat like the Uber of therapy. And I think we've seen a bunch of companies jump into that space and do really well. And it's really great for a patient to be able to, go on an app and schedule an appointment in real time. And as Salome said, get, time with the therapist the next day or 2 days later. So I think that access point continues to evolve. The second that I'd say we're really seeing a lot of, and And, you know, my job is to be out in the market meeting with clients and prospects. And I've been here now at Able2 for 6 years and managed care for a long time before that. We're seeing a real focus now on subspecialties. It used to be where when people talked about mental health, they were really only talking about the, you know, the SMI population, the severe mental illness, the most complex cases. And most of the solutions were focused on, like, how do we get those people out of inpatient facilities or some other lower cost setting to save money? That has changed a lot over the last 5 or 10 years. And I think specifically within the last couple of years, I don't want to call them niche because I think that has a negative connotation, but like these super specific solutions, whether it's for, you know, eating disorders or OCD or an entire network built around diversity to have that as its own offering, right? So we're seeing these like very, very specific programs being developed and rolled out. And in terms of like what's not hot, I would say like nothing, like literally everything right now in the mental health space is hot.
So what's interesting, you know, we hear a lot. I find that we talk about trends that are not yet there yet. Like everyone's excited about artificial intelligence and bots and all this. But what I'm hearing from you guys is what's really kind of happening and what's really kickstarting is just like helping make operations a little more efficient and getting people care and just being able to really streamline that and maybe using, is that augmented reality, I believe, to or augmented intelligence to really kind of close those gaps and to try to make it so that people don't have to wait months and months, but that way they can get care in a matter of minutes, hopefully seconds, right, without having to go through all the waiting time. So as we kind of continue down the journey of digitizing health, one thing that comes to mind, and I think everyone has their own definition of what a digital bubble is, so to speak. And I wonder that as we continue, as the excitement increases, right, and we continue to go down this journey and we sort of geek out in our own bubble of like what's available and, you know, what we have access to and like how can we augment this, how can we streamline this, how can we use artificial intelligence to get us further, and I guess in my own definition of a digital bubble is kind of geeking out in our own sort of environment with forgetting what else is out there and who has access to these tools and who has the capability to leverage these tools. So I wonder, and John, I'll start with you, is, you know, are we in our digital bubble? Are we marginalizing some of those folks that might not be able to access some of these tools?
Yeah, you know, and when I think about, you know, in this bubble, it's hard for me to think of a description of something that's like even bigger than a bubble, but yeah, absolutely. I think whatever's bigger than a bubble, I'd say is what we're in right now. There is just a wild disconnect. I'm an accountant by training, so I'm like super pragmatic and kind of thinking debits and credits and kind of what it takes to run a profitable business. And what I've seen is just this completely wild disconnect between private markets and public markets. And to your chart earlier, Elise, about how much money is being pumped into this space and what that's doing to valuations of these solutions, which many of them they're just not going to be around in a couple of years, like period. There's no way they're going to be around in a couple of years, but we're putting hundreds of millions of dollars into these solutions. And then you look in the public markets, those handful of behavioral health companies that are publicly traded, their margins have come down drastically over the 2 years, and their multiples and valuations have come down drastically over 2 years. And so there's just this wild disconnect. I think a lot of it is FOMO from the venture capital space of just feeling like, holy cow, I've got to get, you know, 1 or 2 or 3 or 10 of these behavioral health startups in my portfolio, and it's no longer the startup selling itself to the VC, it's the VC selling itself to the startup, and they're getting 10 term sheets on these insane valuations. And people, I don't know, I'm interested to hear of others in the panel. I feel like it's particularly acute in mental health, where a lot of entrepreneurs view dollars raised as like a badge of honor. And I always think of it as like, when you raise money, you've now created an obligation. It's not an accomplishment. And maybe you should, instead of just showing your, total amount of fundraising, maybe you should report total amount of funds raised divided by the number of patients that you've treated or patients that you helped, and maybe, would reframe the discussion a little differently.
Yeah, I hear you 100%. I mean, I remember a statistic a few years ago is 8 out of 10 startups fail. And now that the numbers are increasing, I'm sure it's like 9.5 out of 10 startups fail. And I don't mean fail. Well, I probably do mean fail, but that it's really hard to scale, right? And so I want to bring you into this conversation, Niels. What's your thought about this?
I have a couple of thoughts, and on that slide, I'm going to highlight another thing, which is mental health is 5% of our healthcare spend. And when you looked at the VC money, it's representing about 20% of the dollars. So there's an outsized piece there. But there are a whole bunch of things to think about. And I think part of it is because people don't identify with having high blood pressure. I don't hear founders saying, well, I wanted to solve high blood pressure because I had high blood pressure. A lot of people have either been touched by mental health, whether it's themselves, a sibling, a child, and it's led them to try to solve a problem that they had. And that's how a lot of innovation happens. And people are most passionate, especially these days, about mental health. Maybe it was cancer 10 years ago. So I think that's part of why we're seeing all these companies come up. Where there's a disconnect is in sort of who's getting the benefit. So from where I sit, I see lots of companies in the direct-to-consumer space. I see a fair amount entering the commercial market, and I don't see enough work. I'll give a shout out to John and Able to, because I know they do Medicaid work. I don't see enough saying we want to help people who are disadvantaged. So we have, on the one hand, the societal conversation about social determinants of health. We have a societal conversation about discrepancies, socioeconomic discrepancies, race and cultural discrepancies, and yet there aren't enough solutions in Medicaid. And I'd say 4 out of 5 companies that will call me say, we don't do Medicaid. Well, maybe 1 out of 5, and that's generous, does it. And of the other 5, 1 says maybe it's on our roadmap for 2023. So in a way, it's a tale of a bubble on the commercial and employer and direct-to-consumer side. And I still think that there's a lot of room on this large, very excessively large group of people that aren't getting the level of access that others are getting. And that to me is a problem. The second piece is some of the money is very interesting to me, because we do have, I'm going to coin it interventional psychiatry. Others have sort of use the term. We have psychedelics. There's a lot of money going into that. We're not going to see it commercial grade probably for at least 5 years, but there are areas that I think can really change our care paradigms, where putting money into, knowing most of the companies will fail, but finding new innovation, I think, is important. So there's definitely on some paths too much, and then some I think there's still too little.
Yeah, that's a good point. And Medicaid makes up a huge portion of the market, whether you look at it as Medicaid as a customer, if you're, I don't know, a technology startup company, or Medicaid as really a funder, or that they serve Medicaid patients. And I know I come from the Medicaid side of things, and I see a huge lack of technology in that area and access to technologies and these tools in the area. So I'm glad that you brought that up. I want to bring Joanne into the conversation. So Joanne, I know that you're on the phone, and if you can unmute yourself, I do want to kind of ask you is, with these digital tools that we see kind of coming down the pipeline, do you feel like they are streamlining efforts, or are they building kind of more data silos or provider silos. And if you could provide any insight into that. You might be muted, Joanne. Oh, too bad. I think we're having, Joanne, chime in when you get a chance when we figure out the volume. But so maybe I can kick it over to you with that question for now.
Yeah, totally. I think at this point, providers, if they're going to use some kind of add-ons to their daily workflow, the expectation is that, yes, it needs to integrate with their EHR, or it's just, if they're clicking into all sorts of tabs, it's not going to happen. It's not going to be used. But then at the same time, some of these early stage companies who are just getting their footings, it's a lot harder than they think it's going to be, and it takes a lot longer. And unfortunately, it does lead to silos. And so as they mature, the hope is that they'll be further integrated, but I still think there's quite a lot of ways to go on that front.
Yeah, I agree. And I've talked a few times at HIMSS and other forums where, when we started this kind of moving healthcare out of the archaic ice age of writing things down on paper and moved over to electronic, leveraging the meaningful use dollars is, I always remind folks that behavioral health, mental health providers were not included in that initiative, right? So the money really went to the hospitals and the physical health providers. And listen, I know meaningful use was a headache for everybody, and probably still is today, but it did lead us to certain standardizations that we had to follow and certain data fields that we had to collect, whereas the behavioral health providers are kind of, speaking their own language. There's no really universalized languages. And I've seen this from kind of geo-mapping programs where we call the same program 10 different things, because if you look at kind of the funding storyline or the funding structure, many of the funds come from grants or from, federal funds, and then they go down to state funds, and then they're grants that last for a couple years. So everyone has different data points that they have to collect. Everyone has a different goal or a different measure, and then that changes based on the administration or based on the new grant that comes down the pipeline. And it's really hard to integrate some of these cool tools into an infrastructure that's really lacking. I mean, I know behavioral health providers are just either getting on EHRs or, utilizing them to at least 50% capabilities. And so I think we still have a long ways to go. And we talk about social determinants of health in a way that's still very, I think, in theory, almost. I know that I know that folks are measuring it, but when we're talking about kind of national structures like HIEs, is we don't really have a pathway just yet. I mean, we're coming out with some sort of some standardizations, and we're talking about it, but at the end of the day, it's hard to quantify, right? It's hard to quantify behavioral and mental health. And so, Joanne, I heard you're unmuted, and I'd love for you to join the conversation.
Sure. You made a lot of very good points. I agree with pretty much everything you said. I just want to make sure, can everyone hear me? You can hear me okay?
Perfect.
Okay. Well, the very fact that I'm talking to you on the phone right now is an indication of the problems healthcare providers are having, right? There isn't seamless integration of technology, and with that's an issue. But as you said, there's a lot of different applications out there, and no main language, if you will, or integration of systems. But even to step back from that, we have all this fabulous technology, but there's a sort of a generational issue too, right? In that we have to train all providers to use and adopt the technology, and I think that's easier now. So, for example, I'm teaching medical students. There's an area of concentration in technology. There are more graduate students who are interested in it. So with future generations, I think the integration will become easier. But then, you take people like me who've been around around for a while. I started virtual reality research 20 years ago, but the technology wasn't there yet. So people in my generation are not as facile with it and not necessarily as willing to adapt. And part of the reason that is for the same reason that I'm talking to you on the phone right now, is that there are problems with the technology, and as there are with everything, and there are no immediate solutions when a problem occurs.
Yeah. You know, Joanne, you mentioned something really interesting, that you started virtual reality 20 years ago. Can you share, because I know that we had to skip your intro, can you share a little bit about what you're doing on the mental and behavioral health side with virtual reality?
Sure, yeah. So 20 years ago, I'm actually, it's funny, I'm staring at the equipment now, I'm looking at it. I developed, along with a colleague out at University of WashU in Seattle, Hunter Hoffman, one of the first simulations of trauma to be used in the treatment of PTSD. It was very much an experiment then. We did not know if it would work, but it was effective, and we were able to treat people and begin to demonstrate that virtual reality simulations could be an effective tool in the treatment of PTSD. And then I went on to work with combat-related PTSD, and now I'm developing some work with healthcare workers. And in parallel to our work, and digital applications were developing, the commercial grade technology was developing, which is I think the other side. I heard someone speak earlier about how, like, you know, there's pretty much everything out there these days, and the explosion of interest in mental health in part is, I think, because we do have the technology is there in a way that it wasn't there 20 years ago. I mean, the original World Trade Center studies were done with a $25,000 10-pound head-mounted display that is literally, the grounding pole is literally grounded in poured concrete in a bucket in my office. And the equipment was about $25,000, $30,000. Now we can use a smartphone. So the possibility of using the technology is here today in a way that we didn't even dream about, not even 10 years ago. And so the other part of what we need today is not only do we need an integration of technology and a common language, but we also need validation studies. One of the other ways that clinicians will begin to buy in of any generation will be if you can show me, or you can show them, that using a virtual reality tool will help their patient get better, or if it will help them stay in treatment, or it will help them access treatment, you're going to get a lot more buy-in. But that takes time to do that research, and that's a slower endeavor.
Yeah, that's a good point. That leads me to my next question is, you know, kind of to show success, right? Is you can have a really cool idea that maybe costs a lot of money, but now I think we're seeing it's becoming a little more accessible because it doesn't cost as much money to access some of these technology tools. But, you know, John, maybe if you can help me work through this answer is, you know, the solutions that are coming out are they scalable? How do you know when a solution's scalable? Like Joanne just mentioned, right, to really invest in some of the studies and working with providers to show the value. And also, you know, how, aside from are they scalable, how do we know that they're helping to advance state national efforts to really improve care and bring down the overall cost of healthcare?
Yeah, it's you would think, and it's funny. I've worked in health. I've only ever worked in healthcare. It's the only space I'm in. But I love talking to people who are not in healthcare, and they have no idea like how broken the system is, and they kind of just assume, oh, as there's technological advancements, like that's a good thing. But healthcare is the only weird space where, like, as technology improves, costs go up, and so you would think, intuitively in mental health, as we move to solutions that remove human intervention, they're by definition scalable, right? Because oftentimes it's thought of as like the provider is the bottleneck. You can't get an appointment. And so we have to remove the provider from the equation, go digital first, and that's going to solve the scalability problem. But I think the other side of that equation for scalability is affordability, right? And you've got to be able to deploy those technological advancements at scale in a way that's not driving up total cost of care for those who ultimately pay the bills. And I've seen some like really incredible technologies focused on pediatric care for complex social disorders where there's VR immersion and kind of all of this like super cool, amazing stuff. And most people see that and they're like, wow, that's amazing. Like this kid is really going to get better from going through that program. I see that and I'm like, wow, that's amazing. Nobody's ever going to pay for it, and it's unfortunate, right, that there isn't the value there on behalf of the health plan, unfortunately, to want to invest $10,000 for this kid to do a virtual tool. And so I think there are ways and there are solutions out there that are digitally, enabled or digital first, but it can't just be about taking the human out. It's got to be doing it at a cost point that you're going to get a distribution partner, whoever that is, who's going to push it out at scale. I think that's the other side of it.
No, thanks, John. Neil, I got to bring you into this conversation, especially with the work that you do at Beacon Health.
So I guess what I'm going to sort of say, I'll say something a little bit provocative, which is, do we really think that if we turn a chatbot loose, we're going to solve a lot of the big problems in behavioral health? And that's where the scalability question starts to come in. I test a lot of things, and I actually have my 2 teenage daughters test things from time to time. And it's very hard to compete with an Xbox or a Wii or TikTok or whatever it is that they're using today. And the self-service component, which is what a lot of people say, well, we're going to give you this great self-service treatment and people are going to do well. And we have great research that it's effective. Research is great. The people doing research studies are a different cohort than the people we're actually marketing this to and giving it to. And the reality is that in today's world, and when I go to a hotel and when I go to a restaurant, my experience is based on my interaction with the server or the people at the hotel. And it's not just about a nice room and a nice chair and a nice setting. And I think that there's help in self-service. It has a place, but it's not the answer, which brings us back to the people question. Do we have enough qualified people to scale some of these solutions? We're getting better. We are leveraging, so we're getting to a point where with asynchronous care, with texting, we can expand capacity by a certain number, certain percent. We can't quadruple capacity. The people don't exist. There aren't enough therapists, there aren't enough psychiatrists, there aren't enough nurse practitioners. So we can expand it, but I think there's some limit to scalability. And while there's definitely a place for self-service, if you want to go do computer modules on cognitive behavioral therapy and you're motivated, you will do very well. Discontinuation rate, 70 to 98%, depending on who you ask. And that is the biggest limitation on scalability.
Yeah, you make me think of a quote. I'm a quote person, is obviously, if you couldn't tell, that technologies are not the solution, people are. Technologies are the tools we use to build the solutions we need. And I think it's important because I hear all these technology vendors being like, I'm the solution, I'm the end all be all. But no, you're really just a tool and you need people to help engage individuals to actually utilize your tool to make a difference. Joanne, you really kind of kick-started this question and we kind of went down a road here. Wondering if you wanted to add anything here.
Oh, I completely agree with, is it John, I think, that just spoke, what he said, and I wrestle with this problem because I am a clinician, but I am mostly a researcher and an educator, and yeah, the ultimate problem here are the fact that psychological interventions, psychiatric interventions are very much human driven. We can't expand beyond the number of people that we have that are properly trained and qualified, and that in turn gets into the issue of who's training us and who's paying for the training. And because behavioral health and mental health was stigmatized, really, 20 years ago, even it was still horrible, and even recently when I've been talking to young healthcare workers, they would say to me, well, if I acknowledge that I have PTSD or depression, will I get insured? So many of the same cultural value issues are still here, and that ultimately is, I think, the root cause for the shortage of providers and some of the payer system problems, which then in turn leads to what you just said, which is ultimately it's about the people using the technology as solutions, and we don't have enough people. But maybe that's changing.
Salome, where do you see this balance of kind of technology and its evolution to, or its increasing access and kind of building up to the balance with the number of people that are able to kind of like move it forward and make it more accessible?
Right. Like everyone said, there are never going to be enough providers, so we do have to do something different. Going to any one extreme and expecting folks to just do all self-service on their own, that's another extreme. And so I think one interesting thing to tie back to our earlier conversation around funding, and are we in a bubble, and are we starting to see that it'll be harder for companies to raise more rounds, or maybe there'll be some down rounds. I think there'll be pressure on a lot of these companies to go back to fundamentals, and I think a lot of them, unfortunately, might start looking for ways to, I don't want to say cut corners, but find ways to triage more efficiently. Some are already getting some flack for, are you using coaches when you should be using therapists? And unfortunately, I think we might be seeing more of that as more companies get pressured. So there's definitely a place for different levels of care. I think certain companies have been doing a good job of triaging at the front end for where they should go. I don't know how well vendors are doing in terms of re-triaging and making sure that they keep moving to the right levels of care, but I think that's going to be more important than ever as we move forward.
Yeah. We see that a lot with the behavioral health networks that we're working with is, historically it was all on the PCP, right? And I think we've just put so much emphasis on the PCP, and don't get me into like patient attribution on the PCP level, because I kind of advocate for the behavioral health providers on here, is that we have to figure out other ways to deliver care in different types of providers. Maybe it doesn't need to be a therapist, because let's be honest, is a lot of our behavioral health, mental health agencies can't afford to pay a psychiatrist to have them on staff full time, or therapists on staff full time. We've looked at different models of peer support models and other, case managers going out into the field and doing different things. So I think that as we can kind of come up and train different providers and not your kind of standard providers that have been ingrained in our heads to think, oh, that's the provider. I think that we can see access to technologies increase in different communities that maybe we haven't seen before. But there is that work issue, totally. And so I know we're coming towards the end of our panel here. And so what I thought would be fun is if we do kind of a lightning round of asking each of you, what are you excited about in the years to come? I think of, oh God, I know I'm so corny. I'm going to throw another quote at you. I think this is Bill Gates' quote, but I can't remember. I think so. Is that oftentimes we overestimate what's going to happen in 1 year and underestimate what's going to happen in 5 years. So I'm going to ask each of the panelists is, what are you excited about in the next 5 years? What do you think is coming? And let me start off with Joanne. What are you excited about? What type of trends and why?
Well, I'm gonna dream big here. And go a little bit beyond the last discussion. We've been talking about the limitations as the humans, and the reason that we're the limitation is because the standard therapy, as I think we've made reference to, is really individual therapy. But yet there are, going back historically, therapeutic communities like Geel, where people lived in a community and the people with serious mental illness were taken care of by the community. So I wonder if we'll be able to use technology to connect different levels of providers and people with certain conditions, this is beyond group therapy, in a way that would allow us to scale mental health interventions that is not possible today.
Yeah, interesting. Thank you, Joanne. Salome, I'm going to put you up next.
Yeah, I'd say kind of short term. John alluded to this at the very beginning. I'm really excited to see more companies focusing on interventions that are for specialized communities, because as an individual who grew up in a multicultural household, struggled with OCD as a teenager, the needs are different. And, we're moving beyond just online CBT for all, mild and moderate anxiety. And so I'm excited to see that. There are definitely questions around implementation and integration with all the other things, but and then a bigger goal is I'm somewhat of a weekend crypto amateur. Maybe there's something to the tune of decentralizing mental health in the next 5 years.
Decentralizing. Can you elaborate on that a little more?
Yeah, this might take a very long time, more than
you get another few minutes.
We've got a lot of the same players that have been responsible for paying for mental health care, they kind of hold all of the power, frankly, and maybe things would be different if that wasn't the case.
Interesting. Thank you for sharing that. Neil, I'm going to kick it over to you.
Three things quickly. One is the continued destigmatization that is going on in the normalization of the conversation in mental health. I think it's amazing. Two is the promise of some of the new treatments that are coming out. We have a hard time treating trauma. We're not very good at it. So if psychedelics can help, that's great. It'll take 5 years. And then finally, just something that I'm more interested in on the more immediate is passive data collection as a measure for quality. We struggle in behavioral health for what quality really is. The things that I'm looking at and trying to pilot this year would be something that can integrate with a session, record and transcribe a session, use MLP, use some machine learning to give an output. What's the quality of the session? What's the quality of the therapist? Are they making treatment interventions? How many are they making in 45 minutes? How much active listening are they having? Is their diagnosis accurate? And finally, having a window into what's actually going on in treatment, and not just a subjective survey that we give to the member or the client or the patient saying, what do you think? We want to have some more objective data in mental health, and I think the opportunity to use technology to collect that is there.
Yeah, that's a good point. I want to ask you I heard that you want to look at passive data collection opportunities. Did I get that right? Could you explain that a little more?
So there are two ways, there are two sort of paths. One I'm less interested in, which is your typical iPhone tracking your steps, keystrokes tracking your mood, and those type of things. I don't think we're quite there from a data perspective. The second is there are several companies that have sprung up that integrate with telehealth or office-based. They record the session with consent and HIPAA compliance, transcribe it, and then are able to look at it via algorithms and actually judge the quality of therapy being given by therapists. I know it sounds a little bit scary, like Big Brother's watching to some, but to me, I think the good therapists want that feedback. Honestly, I still see patients. I'd love to know what I could do better. It shouldn't be punitive, but it is a way towards value-based care, where if I know that John as a therapist is performing in the top 10%, I think he should be paid more, to be very honest. And I want to encourage John to take more patients. And I want to really look at it that way and find who are my great therapists in my network or in my clinic and reward them. And the ones who aren't, know what they're not doing well and try to bring them up to a higher level.
Thank you for sharing that. I appreciate that. Really interesting. I'd like to see more of that, especially on the behavioral health side. Last person I want to tee up before we open the panel up to questions from the audience is John. What are you excited about in the next 5 years and why?
I'd say a couple of things, and maybe building a little bit on what Salome and Neil both said. Solomay mentioned dealing with OCD as a teen and kind of that setting her down this path of wanting to make a difference. And I'd imagine that, Solomay, when you were going through that, right, that was very difficult and felt alone and challenged. And where am I going to find the support? And now I look, not all that much later, my son, who's now 16, when he was 12, diagnosed with OCD, and no stigma. Like there's no embarrassment, there's no shame, there's no need to feel alone. And I see it with his group of friends, and it's just amazing to know that in that short period of time, how much the market has moved, and there's that. Why has it not always been like that, right? And it's just this amazing transformation that's taken place in the market pre-COVID, massively accelerated by COVID, where there's a recognition that, what's the line, like, it's okay not to be okay. And that we have CEOs taking, mental health days, and we have, senior leaders setting the example for their employees that, like, this is okay. And I struggle with depression or stress or anxiety as much as the next person. So that kind of destigmatization is going to go a really long way for adoption of some of these tools. And then I think on the end to that, I think in part because of that, like, all of the best minds want to work in this space. My greatest recruiting tool when I'm interviewing candidates isn't about salary or options or equity or whatever. It's like, do you want to come be part of this really amazing team who's making a really big difference in this space? And you get to feel good. For me, like, as an accountant, the fact that, like, when I'm successful at my job, it's directly leading to more people getting the help that they need. Like, that is amazing. And I think it's a magnet for great people coming into this space. And I think because of that, it's kind of weird, but, like, people ask me all the time, like, who's Able2's biggest competitors? And, like, I feel there's a different sense of collaboration and partnership in this space than in other specialties, because we all realize this problem is way too big. Beacon is not going to solve this problem. Able2 is not going to solve this problem. Aetna is not going to solve this problem on its own. Like, we need to work together collaboratively. And kind of the rising tide lifts all boats. And I've felt that from the first day at Able2 with all of the different partners we work with it. We're in this together. This is a national crisis. And it's been just amazing to see the transformation over the years.
Yeah. Thank you, John, for sharing that. I echo what all the panelists really just said. I want to thank you guys so much for joining us today. This is great. And, we have about 8 more minutes left, so I really want to open it to questions from the audience. I think Joe and Tony, you guys are triaging some of the questions. So if you want to bring any up to our attention.
Joe, why don't you bring them up?
Sure, thanks. Let me see if I go back to the first one here. Okay, from Kennedy Ganti, we have, how does all this technology overcome the most fundamental issue with behavioral health, availability, of providers? There's a chronic workforce shortage. Can anybody address that?
I know we talked about it during the panel, that I don't know if it's going to be the end all be all solution, but do one of you guys want to kind of expand on some of what you shared today?
Yeah, I guess I could quickly say now more than ever, we're seeing new peer support startups launching. I think a lot of the major vendors have also launched coaching, just different alternatives to lower, depending on the acuity of care, different alternatives that folks can start with if they're not quite needing to see a therapist right away.
Thanks, Salome.
Okay, I'll jump to another one. Frank, we'll give Frank a twofer here. Frank is asking about access beyond medication prescribing, specifically technology solutions or workflows addressing suicidality and crisis. And part B, or part 2, is how are companies measuring ROI? Is it around readmission rates or ER visits or other things necessarily not necessarily financial.
Is that a Neil question? Yeah.
I'll try to answer all those pieces. So in terms of, suicidality and crisis, these are areas of major focus. There's actually been a lot of money flowing into that area and a lot of attention. So there actually is a company we've partnered with that treats people who are high risk of suicide. It really should be a specialty. It's very complicated. And the same thing with crisis. And an early adopter, Crisis Text Line, really started doing something long before anyone else did, which is offer people an easy way in to get help. And that model has been evolved. We actually have a couple of crisis centers that we man, and we do text and chat as well. So they've really led. So that's been amazing. In terms of ROI is always measured on two things. One is cost of care. That's sort of the reality of healthcare dollars. And I think John may have spoken to that at the beginning, where if it doesn't make sense, it doesn't matter how good it is. It has to make sense on some level economically. The second piece is that I think wellness is more and more becoming a part of the conversation where it wasn't, and mostly led by employers. There's an expectation that your benefits, whether they're managed behavioral or EAP, have some wellness components, that it's not just you must see a therapist or a psychiatrist. It's what else can you offer? And that's becoming the standard. It's behind in the entitlement section. So in Medicaid and Medicare, we're not there yet. But most employees, if you go on your EAP page or even your managed behavioral benefits, there are wellness benefits there. And it's less about a pure ROI and more about wellness.
Yeah, thanks, Neil.
This one I think is aimed more at Joanne, probably. I think as far as current focus, could the panelists address group therapy facilitation in VR, i.e. healthcare workers have peer-to-peer support with professional moderation?
So if the question is that feasible to do use a virtual platform to connect socially with people and do some form of therapy? Yeah, that's sort of what I was alluding to earlier when talking about the next phase, developing online therapeutic communities in a different way that they've been done so far, like it's not like in Second Life. So the short answer is yes, it's feasible. It's not quite what we're doing, but that is just a good idea. I like it.
I'm gonna take a little facilitator's license here, Joanne, and just ask you about applying these technologies to healthcare workers. If you could touch on that a little bit more as well.
Right. So are we talking about specifically the virtual reality technology that I've been working in, or more broadly apps to facilitate our productivity and connectivity to our patients, or both?
I guess let's start with VR. I mean, what do you see as the opportunity for VR to help with, stress and burnout and just PTS and things like that that you touched on in more broader terms?
Well, we're as I mentioned earlier, we're developing virtual simulations to use in the treatment of PTSD, but also to use just for simple return to work. Like, so not everyone meets diagnostic criteria and should have treatment for trauma, but yet they have anticipatory anxiety about going into work and perhaps would benefit from rehearsing either in a self-help way or with a therapist online. And so we're developing tools like that and facilitated discussions among healthcare workers. And then to jump to the second part, I can certainly say that during the first wave of the pandemic, when we developed a team-based crisis approach to our medical workers, and then crisis counseling, using the app to schedule appointments really helped a lot. It made us more efficient, and at the end of the day, I suppose you probably squeeze an extra hour or two out of the work week if you're not so tethered to paperwork and charting and scheduling and things like that. So that is one way to increase the efficiency in the system, although it's certainly not a very it's not a real sexy way, but it's an important one.
Thanks,
Thank you.
I could go on. I think we've run out of time. So I'll be quiet.
Joe, do we have time for one more question, or do you think we should wrap up?
I'll leave that to Nick. I would go another 20, but you know, that's me. I know we have a lot of people who want to be mindful of time.
Another question be fine, not a problem.
Okay, maybe this one's to John and also Salome. I know this was a topic on one of your podcasts recently. There was a mention of the Uber model for behavioral health. Any thoughts on the lag time to getting a driver's license with the analogous 3 to 5 years to become a licensed mental health counselor?
Yeah, I'm John, you're on mute.
Hold on.
Okay, I think you're back, but yeah, either way. Happy
Okay, can you hear me now? Sorry.
Yeah.
You know, this is it's like a ridiculous problem around cross licensure rules that in my mind, you know, there's an opportunity for massive regulatory change that can greatly solve this problem, or not, it actually won't solve the problem, but it'll have a major impact on the problem. We have certain states today where we're overutilized, right? We've got tremendous need, and it's hard for us to find appointment time for people. And then we have other states where we've got excess capacity and we've got providers kind of sitting on the bench with nobody to help. We do all of the heavy lifting required to get those folks cross-licensed so that they can then deliver care in different states, but sometimes that takes years. And so it's one of these spaces where the regulatory environment just has not yet caught up with the way people want to have care delivered to them. There were some loosening of those regulations that came out during COVID. It'll be interesting to see kind of how that market moves over time, but I think that's something with, you know, the swipe of a pen in Washington can really help alleviate some of those pains like overnight. I don't know, Salome, anything you'd want to add to that?
Yeah, only in terms of like talking about Uberization of mental health care, I'm thinking more from a provider's perspective. You know, so many of them 1099 folks are on so many different platforms. They're jumping from one app to the other to the other. You know, how much are they truly following the protocols of any one company? So I think it's something we have to be mindful of. And it does seem to be a trend of more vendors bringing in providers in-house full-time as much as possible. But again, competing for the small pool that there is.
Yeah, that's fair. You know, I know that we're a little over time and I don't want to, I know that folks have to go to the next meeting and whatnot. So I just want to thank you, our panelists, so much. And Joanne, thanks for joining us on the phone. I know it took a while, but, you know, I really appreciate all of your insights. And I think that this, you know, at the end of the day, I think it's a very exciting time for behavioral health, especially in this IT sector as we kind of move forward and work on different tools to create different solutions that we need. So I'll give it to Tony to kind of wrap us up.
Thank you very much. I really appreciate it. Thank you to all the panelists. What a great presentation again. A lot of insightful information that we were able to share. Sorry we couldn't get to all the questions, but look for the next session coming up, which will be published both on our website and through our social media. Everybody have a great day. Come on back for some more great education that is being provided by the New York HIMSS chapter. Thank you. Have a great day, folks.
Thanks.